Hi everyone, Stephen from Club Dental. I'm going to talk to you today about bad breath. It's something that at the moment I think everybody's happy to be wearing masks, and the small advantage is that you get to hide your bad breath if you have bad breath. Anyways, some tricks for looking after it, for combating bad breath. Number one is I think a pretty obvious one. We want you to brush and floss your teeth. And I think the brushing part is reasonably obvious for most people. An electric toothbrush is going to be more effective than a manual toothbrush. We're pretty happy with electric toothbrushing. With flossing, we want you to go up and down between your teeth, upper and lower teeth, all the way around. At least once a day with the flossing, twice a day with the brushing. Another obvious thing that I think most people would guess I would be saying is go to the dentist every 6 months. Come on in, get your checkup done. If there's a source of that odor coming from somewhere in your mouth, we can discover it, we can do something about it. If it needs a strategy to combat it long term, we'll figure it out here as well. One other thing is your tongue. It's something that a lot of people neglect or don't even think about. Is when you brush your teeth, after you've finished brushing, you should take your toothbrush and brush your tongue like that. Spit out. You'll actually find that you'll probably see some discoloration in your leftover toothpaste, which is the plaque and staining food debris that's stuck to the top of your tongue. So it's just on the surface, on the top surface of your tongue, that we want you to brush. And that's something that you can do every time you brush. It's simple enough to do. If you don't want to use your toothbrush, or you find it easier, you can also get a specialized scraper. There's a tongue scraper that you can get from the chemist, and a tongue scraper will be more effective for some people. You're trying to get as far back onto the top of your tongue as you can without making yourself sick. So one of the tricks I find is to really think about breathing through my nose really carefully while I'm brushing the top of my tongue, knowing that if I gag, I will throw up. So I got to be careful, and so do you. And an easy one to say, harder one to do. It's becoming less of a problem now. Is quitting smoking. It's something that will have an impact on your breath. It'll also mean that you're more likely to keep your teeth for your whole life. You're less likely to have gum disease problems, and a whole bunch of general health benefits there as well. Staying hydrated, drinking lots of water. Drink lots of water. You're going to clear any food debris. Anything that's stagnant in your mouth will be rinsed away. And also the extra hydration will help you to produce saliva, which will clear or clean areas that are going to otherwise remain sticky and built up and stagnant. Final thing that you may automatically go to is using a mouth rinse. Now, you can use minty rinses and they'll do something, but they're only short-lived, the benefit that you get out of them. If you use something like this one, this is Closest. It has an active ingredient, which is the chlorine dioxide. And chlorine dioxide will actually eliminate odors. And that will actually be things like garlic and onion and things like that you think you can't do anything about it. You brush your teeth and you still are conscious of having that odor, and so using a chlorine dioxide mouth rinse will actually work on breath issues that wouldn't otherwise be beaten. Sugar-free chewing gum is a good one for providing that minty scent, and also helping you to produce saliva as well. It's another saliva-producing thing, stimulating your saliva production with chewing, the chewing action. And mints are okay as well, again, if they're sugar-free. got to be really careful that you're not consuming large amounts of sugar in order to suppress a breath concern, because then you will have a problem, because when you go in here to the dentist, you'll have a bunch of decay spots in your mouth, which will then have to do fillings for you or more. I hope this has been helpful. I hope this has stimulated some thoughts. If you have any questions or comments, any suggestions, in the comments box down below. Otherwise, cheers. Stephen from Club Dental. We'll see you next time.